بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. شلونكم طلاب؟ إن شاء الله تكونون بخير. وياكم دكتور أحمد الموسوي. راح أكون في محاضرات الانتيريور ابدومينال وول بمشاركة الدكتور سامح. محاضرة اليوم عنوانها anterior abdominal wall part 1. So I will start with the objective of this lecture. By the end of this lecture, the student will be able to have idea about the abdomen and its clinical importance, define the layer of anterior abdominal wall, understand the abdominal regions and topographical surface landmark, define the superficial fascia layers and its extension, and finally understanding the anterior lateral muscle of anterior abdominal wall with the blood and nerve supply in addition to its action. So I will begin with the simple introduction about the abdomen. The abdomen is the lower part of the trunk. مثل ما تعرفون الطلاب trunk يتكون من two parts, the thoracic region and abdominal region. So the abdominal region considered the lower part of the trunk. Its wall surrounded a large cavity called abdominal cavity. The abdominal cavity is much more extensive than what it appears here in this picture and from the outside, because it's ascend behind the costal margin up to the diaphragm from the above and continue with the pelvic cavity downward. So considerable part of this cavity is overlapped by the thoracic cage from the above and bony pelvis from below. Sometimes the abdominal cavity is divided into two large cavities, the abdominal cavity proper and pelvic cavity, by plane drawing at the pelvic inlet, so that the abdominal cavity consider the largest cavity in the body and surrounded by anteriorly by abdominal wall that formed by the muscle and superiorly by the diaphragm that separate it from the thoracic region. Posteriorly it's surrounded by the posterior abdominal wall that formed by the muscle and lumbar vertebra and continue inferiorly with the pelvic cavity. Laterally this cavity surrounded by the thoracic cage from the above and the iliac crest from below, so that the anterior abdominal wall surrounded and cover large surface area in the body, and it extend from costal margin from the above and xiphoid process and by groove of groin and anterior superior iliac spine with the pubic symphysis, pubic crest and the pubic tubercle from the below. In order to study the anterior abdominal wall, we must know about the surface landmark that founded in this wall. For easily study of this wall, we divided the surface landmark into two groups. The first group هو bony landmark and the second group is soft tissue landmark. إذن عندنا two group. الجروب الأول اللي موجود بالانتيريور abdominal wall هو البوني landmark, والجروب الثاني هو السوفت tissue landmark. First I start with the bony landmark founded in the anterior abdominal wall, and I start with costal margin. The costal margin will form by rib 7, rib 8, 9th and 10th and ascended upward until it reached to the midline, where it met the costal margin of the other side at the middle and forming angle called infrasternal angle or sometimes called subcostal angle that enclosed between them a xiphoid process. So the second part or second bony landmark هو الزيفويد process. The xiphoid process consider a third part of the sternum and enclosed within the subcostal angle or infrasternal angle. Sometimes this part bends forward so can be easily palpated under the skin. The xiphoid process located at the level of tip of ninth costal margin. And the last bony landmark founded here in the anterior abdominal wall will iliac crest. Iliac crest consider the lower limit of the anterior abdominal wall, and when we traced it anteriorly we reach to the anterior superior iliac spine, and when we move 5 cm posteriorly we will find the iliac tubercle. This is the end of first group. Then we will move to the second group اللي هم soft tissue landmarks. نبدي ويا الجروف of groin and that descend from anterior superior iliac spine and pubic tubercle and represent the skin that cover the inguinal ligament. The second landmark founded here is linea alba, which is a midline furrow founded in the midline of the anterior abdominal wall extended from xiphoid process to pubic tubercle. And this is corresponded to the linea alba, which is a tendinous raphe that founded and made by the aponeurosis of anterior abdominal muscle. Other landmark is the umbilicus. Umbilicus is a depressed or elevated scar founded in the midline furrow or founded in the linea alba just below the middle of the abdomen. Other one is linea similionaris. Linea similionaris is a curved furrow founded lateral to the midline furrow about a few centimeters and extended from the tip of ninth costal cartilage until it reached to the pubic tubercle, and it corresponded to the lateral margin of rectus muscle. Then we move to linea transversalis that corresponded to the tendinous intersectionis that found in the rectus abdominis muscle, and it's more obvious in individual with well-developed rectus muscle. The last of soft tissue landmark is line of Venus, which is semilunar line with the concavity face upward and founded only in the female and located between the umbilicus and the pubic symphysis. So, for easy study of the abdominal wall and for guidance of the doctor to the abdominal organ and pain associated with this organ, we can divide the abdominal wall into two group of topographical division. The first one is simple 4-quadrant topographical division, and the second one is 9 region organization description pattern. So for simple 4-quadrant division of the anterior abdominal wall, we use two planes: vertical plane that passes from the xiphoid process to the pubic symphysis, and the second horizontal plane that called transumbilical plane that passes through the umbilicus and intervertebral disc of L3 and L4. This two plane will give me a 4-quadrant for the anterior abdominal wall and abdominal cavity that called right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Also, we have a second topographical division, which is a 9 region description pattern with two vertical plane and two horizontal plane. The two vertical plane passes from mid-clavicular point at the above and to mid-inguinal point from below. Two vertical plane and two horizontal plane. Upper horizontal plane that called subcostal plane that passes just beneath the costal margin through the body of the third lumbar vertebra, and the other horizontal plane or lower horizontal plane called intertubercular plane that passes in the tubercle of iliac crest of both sides. So two vertical plane and two horizontal plane will give me a 9 region to the abdominal cavity and abdominal wall that called right hypochondrium, epigastric region, left hypochondrium for the upper row. For the lower row, right groin, pubic region and left groin, and middle row, right flank, umbilical region and left flank. So the anterior abdominal wall consists of 8 layers. Some anatomists divided it into 9 layers when we divided the second layer into 2 layers, as we said following. So the first layer is the skin. This is the skin of the anterior abdominal wall. Second layer, fatty layer of superficial fascia or called Camber's fascia. The third is a membranous layer of superficial fascia, Scarbus fascia. And when we consider these two layers as a one layer of superficial fascia of the anterior abdominal wall, we have 8 layers. And when we divide it, as I said before, into fatty layer and membranous layer, I obtain a 9 layer. So the third layer, membranous layer of superficial fascia, fourth, external oblique muscle layer, and fifth, internal oblique muscle layer, and sixth, the transversus abdominis layer, and then fascia transversalis. After that, extraperitoneal tissue, and then parietal layer of peritoneum. So I will start with the skin of the anterior abdominal wall. The skin of the anterior abdominal wall considered as thin and more sensitive than the posterior abdominal wall. Also, it contains a cleavage lines called Langer's line, which corresponded to aggregation of collagen fiber in this layer that discovered by the Austrian anatomist called Karl Langer. This Langer's line found it elsewhere in the body and mostly perpendicular to the muscle. So when the surgeon made a vertical incision to the Langer's line, it will heal with the bad and ugly scar. But when he made a horizontal incision in the anterior abdominal wall, it will heal with the linear and soft scar. Also, the anterior abdominal wall contains stria that are branch and ugly line that correspond to degenerative fibrosis of subcutaneous tissue found only in multigravida female. This multigravida female معناها شنو؟ مرأة متعددة الحمل أو الإنجاب. عندنا مصطلحات ثانية فيما يخص المالتي جرافيدا، هي برايمي جرافيدا، المرأة التي لديها إنجاب واحد أو طفل واحد، ونيلي جرافيدا التي لم تنجب قبلا. So this trigravidorum founded only in multigravida female. Also founded in the skin of the anterior abdominal wall, in the center of the abdomen, the umbilicus. This is the umbilicus. As we said before, it is a depressed or elevated scar found in the anterior abdominal wall and corresponded to fetal attachment of umbilical cord. The position of this umbilicus at the intervertebral disc of between the L3 and L4, and sometimes this position varies according to the age. In old age, due to diminished the tone of the abdominal muscle, it will be at the lower level, and in the children also founded in the lower level because of underdeveloped of pelvic organ. So at the umbilicus there is a 4 embryological remnant founded attached to the umbilicus. الأولى هي ligamentum teres, which is a ligament connect the umbilicus to the liver and corresponded to the left umbilical vein, and 2 medial umbilical ligament, which are a remnant of umbilical artery, and 1 median umbilical ligament that connected the umbilicus to the urinary bladder, and it is a remnant of allantois. The second layer of anterior abdominal wall called superficial fascia. Superficial fascia, or sometimes called subcutaneous tissue, it resembles any superficial fascia founded in the body, especially at the upper part of the umbilicus, where it consists from single layer of subcutaneous tissue. But below the umbilicus, the superficial fascia will be divided into 2 layers: fatty layer, Camber's fascia, or membranous layer, Scarbus fascia. The fatty layer containing variable amount of fat and continue downward over the inguinal ligament to be continued with the superficial fascia of the lower limb, while the Scarbus fascia or membranous fascia considered as a thin membranous fascia contain no or little fat. Fatty layer will be descended downward to cover the penis after it's loose. It is it's fat and united with the membranous layer. Then descend downward to cover the scrotum to form a specialized fascia called dartos fascia, because it contains some smooth muscle fiber. Also, the membranous layer will be descended downward to cover the penis and scrotum to form the dartos fascia, as we said earlier, but the membranous layer attached firmly to the linea alba and to pubic symphysis, then descend anterior to the perineum and attached to the ischiopubic rami to form a superficial perineal fascia called Colles fascia. Also, the membranous layer will be attached to the pubic symphysis and send extension to attach to the dorsum and the side of the penis to form a fundiform ligament of penis. The third layer and fourth and fifth consist from muscle. There is a 5 muscle founded in the anterior abdominal wall. 3 of these muscle is flat and fiber run in posterior-lateral direction or anterior-lateral direction, and 2 central muscle. 2 central muscle founded are rectus abdominis and pyramidalis attached to the rectus abdominis muscle, and it is small and sometimes appear and sometimes absent. And the 3 flat muscle, external oblique, internal oblique, and transversus abdominis muscle. These muscle have its specific action, but it collectively perform a general action that help the body in various functions. From this actions, these muscles will form the anterior lateral abdominal wall that keep the abdominal organ in its position during erect position under action of the gravity. Also, it protect the abdominal viscera from an injury and another thing. In addition, it help in quiet and force inspiration during respiration of a human. In addition, it will help in the childbirth, cough, vomiting, and another function. So, we will start with the largest muscle, external oblique muscle, that consider the third layer of the anterior abdominal wall. It takes its origin from the outer surface of the lower eighth rib, and its fiber directed downward and medially as shown by this picture, and inserted into the iliac crest and to the linea alba that formed by the aponeurosis of this muscle. When this fiber of external oblique descend downward and medially until it reached to the anterior side of the abdominal wall, it converted into the aponeurosis until it reached to the middle line. It will be, and it went with the another external oblique from the opposite side to form this linea alba. Also, at the lower free edge of this muscle from the external aponeurosis, the lower edge will be reinforced itself by folding itself and form a ligament extended from the anterior superior iliac spine to the pubic tubercle. This ligament called an inguinal ligament. Also, there is an extension from the inguinal ligament along the pectineal line, forming a crescentic shaped ligament called lacunar ligament, and sometimes there is an extension from lacunar ligament along the pectineal line called pectineal ligament. This is the fiber of the external oblique muscle that descended downward and medially. When it reached to the anterior abdominal side, it will be converted into aponeurosis that met with the another aponeurosis to form the linea alba. The second muscle is internal oblique muscle, that much smaller and thinner than external oblique, and its fiber run upward and medially as shown by this picture. It takes its origin from the thoracolumbar fascia and from the iliac crest between the insertion of the external oblique and origin of the transversus abdominal muscle. Also, it takes origin from the lateral two-thirds of the inguinal ligament and the pubic symphysis, in addition to the pectineal line. It is inserted into the linea alba, pubic symphysis, and pectineal line. Transversus abdominis muscle, as its name, transverse, its fiber run transversely and take origin from the thoracolumbar fascia, iliac crest, and lateral one-third of the inguinal ligament, inserted into the linea alba and pubic symphysis and pectineal line, in addition to the lower 3 or 4 costal cartilage. Lower 3 or 4 costal cartilage. This is the fiber of the transversus abdominis, run transversely until it reaches to the anterior side of the abdominal wall to form the aponeurosis. And also, this is the direction of fiber of internal oblique muscle that run upward and medially. Also, it will form aponeurosis and inserted into the linea alba. Central muscle founded in the anterior abdominal wall, rectus abdominis muscle, that take its origin from the pubic symphysis and ascended upward to be inserted above with the xiphoid process and lower ribs. Also, it is two rectus muscle founded at the side of the abdomen, separated by the linea alba, and when it gets ascend, it more flat and widen in the ascending, get more flattened and widen during ascending. It has 3 to 4 tendinous intersections founded in the rectus abdominis muscle, and as we said earlier, it is more obvious in well-developed rectus muscle in athletic person. The final muscle founded, there is a small muscle called pyramidalis. Pyramidalis is a triangular muscle attached to the rectus abdominis muscle, with the apex attached to the pubic symphysis and base attached to the rectus muscle. Its main action is tenses the linea alba. This is a pyramidalis, a small muscle. So the action of this muscle of anterior lateral abdominal wall is to flex the trunk and bend the trunk to the same side. شوف هذه المصل هنا مبينة شلون متقلصة زين حتى تسوي bending of the trunk to the same side. Also to turning the anterior side of the abdomen into the opposite side. هذا anterior abdomen to the left side and the muscle contracted of right side. This picture here summarize the action of anterior lateral abdominal wall. This is an flexion of the trunk done here, and bending of the trunk on the same side by the action of the same side muscle, and turning of the anterior side of the abdominal wall into the lateral part by the muscle of opposite side. So this is contracted muscle. This is summarized, as I said, the action of the anterior lateral muscle. Before I leave the anterior lateral abdominal muscle, the rectus abdominis muscle enclosed in a sheath called rectus sheath. The rectus sheath cover the entire rectus muscle anteriorly and posteriorly by 3/4. So the pattern of covering the rectus abdominis muscle done in the upper mid half of 3/4 of the abdominal wall of the anterior abdominal wall, covered by the aponeurosis of external oblique and half of aponeurosis of internal oblique. From the posterior side, it will cover only by 1/2 of aponeurosis of internal oblique and the aponeurosis of transversus abdominis muscle, while in the lower quarter here all the aponeurosis will cover the anterior side of the rectus abdominis muscle, while the posterior side came in direct contact with the transversalis fascia. So there is no aponeurosis covering the rectus abdominis muscle. ملخص الحكي هذا اللي 3/4 راح تتغطى from the anterior and posterior part by the rectus sheath. But this lower quadrant هذا الربع الأخير راح يغطي الأبونيوروسيس بس من الأمام، أما من الخلف المصل راح يصير in direct contact with the transversalis fascia. زين، شنو هي الترانسفيرساليس فاشيا؟ ترانسفيرساليس fascia is investing fascia of the muscle. All muscle of the anterior abdominal wall cover from anterior and posterior by investing fascia of the body, but it unremarkable. Only the transversalis fascia, which is the deep fascia of transversus abdominis muscle that cover the whole of the abdominal wall and extend it above to unite with the investing fascia of the diaphragm and fascia of the thoracolumbar region, and continue to the opposite side with the transversalis fascia of the other side. Also, it descend to be continue with the pelvic fascia to form endopelvic fascia, and continue also with the fascia of the muscle that attach to the upper part of the bony pelvis. So it continuous layer that cover all of the abdominal cavity. This is the transversalis fascia muscle, transversalis fascia, that cover all anterior and posterior abdominal wall and continue with the fascia of the diaphragm and to the pelvic cavity. Also, it will unite with the lumbar fascia. Extraperitoneal fascia. Extraperitoneal fascia, this is the layer that separated the transversalis fascia from peritoneum. This is the extraperitoneal fascia. Found it here. Contain a variable amount of fat and concentrated especially in the posterior abdominal wall and around the kidney. Especially it contained in the vascular bed that supply the kidneys and other viscera and extended to the mesenteries to supply the gut. After that, we will move to the nerve supply of the anterior abdominal wall that came from a spinal nerve of T7 to T12 plus to the L1. The spinal nerve, after merge from the spinal column, it will give the lateral cutaneous branch that move from the posterior side of the body to the anterior side. As this move and descending in anterior medial direction, it will give the anterior cutaneous branch. The anterior cutaneous branch لما يوصل للlateral edge of the rectus sheath, it will be pierce the rectus sheath, يثقبها ويدخل at the lateral margin of the rectus abdominis muscle. حتى لما يوصل للميد لاين راح يفوت من خلال الريكتس abdominis muscle وراح يطلع at the midline to supply the skin. The T12 and L1 move in similar direction and supply the skin of the anterior abdominal wall. The nerve supply of the anterior abdominal wall will divide it into three groups. 3 فوق الامبلايكس و3 جوا الامبلايكس، وبمنطقة الامبلايكس اكو نيرف واحد يغذيها. So the nerves that supply the anterior abdominal wall above the umbilicus are T7, T8 and T9. T7, T8 and T9. And the 3 nerves that supply the anterior abdominal wall below the umbilicus are T11, T12 and L1. T11, T12 and L1. So that the umbilical region supplied by T10 dermatome. Then level of the umbilicus دائما يشير لي إلى T10 dermatome. The blood supply of the anterior abdominal wall come from different origin. The blood supply of anterior abdominal wall supply the wall superficially and deep. From the above, superficially, there is a musculophrenic artery, which consider a terminal branch of internal thoracic artery. In addition to from the lower part by inferior or superficial epigastric artery and superficial circumflex iliac artery, that is part of and branch from femoral artery. At the deeper layer, the blood supply of the anterior abdominal wall came from superior epigastric artery, which is a terminal branch of internal thoracic artery at the midline, and from the lateral by intercostal arteries of T10, T11 and subcostal artery or T12 intercostal arteries. In addition, from the lower part at the deeper surface, there is inferior epigastric artery and deep circumflex iliac artery, which are branches from the external iliac artery. The inferior epigastric artery and superior epigastric artery will passes through the rectus sheath at the middle and united together to form an anastomosis. The venous supply of the anterior abdominal wall corresponding to the same name of arteries. يعني عندنا superior epigastric vein وعندنا inferior epigastric vein وعندنا deep circumflex iliac vein and superficial circumflex iliac vein in addition to musculophrenic veins. Thank you for listening.